Mr. Griffith, for your 5 minutes of questions.
Thank you very much, Madam Chair. I appreciate it. And I appreciate the suggestion that maybe the Doc Caucus get together with the attending physician's office, because while I was one of those who was lagging, I lagged because I had, in getting the vaccine, I lagged because I had the disease and felt like others should go first, because we do need to get our staff and other folks who are here in the Capitol vaccinated as well. And so I've now had my first shot and will soon have my second shot, but also had the disease last year. And so we've got to be getting close. Of the 435 of us in the House, we got to be close to herd immunity if we aren't already there. That being said, Dr. Collins, if I could ask you a couple of questions. I have a friend who has long-term COVID. He's been in the hospital 4 times with breathing difficulties and just can't seem to shake it. From a public health perspective, does the fact that a patient has had COVID-19 change the approach that you would recommend to the doctors who are treating or taking care of that individual?
That's a great question, and we are learning as we go. You may know there are now more than 60 clinics that are set up specifically to try to understand how best to provide medical care to long COVID sufferers. And you're going to hear from 2 of those clinic leads in the next panel, from UCSF and from Yale. And I think they are trying to see what kinds of things are going to be most beneficial. It does seem that some sort of pulmonary rehabilitation and cardiac rehabilitation, if the symptoms are there, as well as some of the things that are being done to help with the brain fog, many of which are built upon experiences we've had helping people who had traumatic brain injury or concussion. Those do seem to help. But at the moment, it's really kind of learn as you go. So yeah, I would certainly think somebody who's got long COVID ought to explain to the physician that that was their history, because the way in which they're going to be understood and managed is going to be very much related to that background.
And even if they go in and reporting for the first time and maybe haven't been diagnosed with long COVID yet, it may be helpful for them to say, I had COVID 4 weeks ago. You might want to be on the lookout for other issues.
Absolutely.
Now, you mentioned the layers of current research being done on the effects of long COVID. Is there research being done on the relationship between COVID-19 vaccinations and long COVID?
So we do know that there are reports, and we mentioned this a bit earlier, of people who have long COVID where the vaccination seems to have provided some relief of symptoms, but it's not universal and it can be pretty mild. Otherwise, just flipping it around the other way, in terms of whether vaccinations prevent you from long COVID, yes, we believe so, in that they prevent you from getting COVID in the first place, 95% efficacy for the Pfizer and the Moderna vaccine. So as all of us have been saying, if you don't want long COVID, then you don't want COVID, then get a vaccination, because that's the best prevention we've got.
Yeah, and my friend got the COVID and the long COVID before the vaccination was available to him.
Of course.
Yeah. So let me ask this, and let me give you a chance for a little advertisement. If somebody would like to participate in an NIH study, who should they contact, or what's your website that they should go to?
That is a great question. Thank you for the opportunity for the advertisement. It's very easy. You go to clinicaltrials.gov, clinicaltrials, one word, .gov. And I looked in the last day or so, there are at least 30 clinical trials up there right now that are enrolling participants that are interested in trying to understand long COVID. And that's even before we make this whole bunch of new awards in the next 3 weeks or so, which is going to greatly expand that. But people who want to get started now, clinicaltrials.gov.
And of course, you need as many people as possible in order to get all the data that you can get.
Absolutely.
So you don't have just 44 people involved in a long-term study.
No, we want thousands, tens of thousands.
Thanks. I just have a minute left, Dr. Brooks. Vaccines are not currently recommended for those who've tested positive for COVID-19 within 90 days. Is that based on concerns about the vaccine interacting with the virus, or is it an attempt to reserve doses for those without antibodies?
Right. Let me just, the recommendation is that persons do not have to get vaccinated within those 90 days. They could opt to wait 90 days, but we do recommend that if people want to get vaccinated, they can. The concern, though, is that having had the infection, the residual immune response to the infection may blunt the benefit that you would get from the vaccine. So we want to give time that the immune system is basically kind of rested again, so that when you give them that vaccine, they have the best chance of having a good response.
All right, I do appreciate that and encourage anybody who wants to be in an NIH study to please do so. I've told the committee several times I think I might even be in two, but I always go to the same place and they take good care of me. With that being said, I yield back.
The gentleman yields back, and the entire committee thanks you